Hello there, I'm Helen Moore. I'm a consultant paediatrician here at Chesterfield Royal Hospital, and I'm going to talk to you today about human factors. So, have you ever gone into a building, gone to push the door open, and it's actually been firmly shut because you needed to pull rather than push? When we do this, particularly when we've got people around us, we can feel quite silly and embarrassed and feel that we've made a mistake. But is that our mistake? Or is it more of the fact that the door wasn't designed properly to meet our needs? If we were to be educated and told from now on you need to pull that door and not push, would that stop other people not making the same mistake that we did? Similarly, if you look at the picture on the slide of the bike lane, clearly that is a system design where bikers are going to increase their risk of error on that bike lane. So what are human factors? Well, human factors are all the things that influence us. That can be individual factors such as fatigue. It can be about the team around us and how we communicate with the team. And it can be about our system. It can be about the equipment that we use. It can be about our work patterns. It can be about our policies, our procedures. All these influence us. But human factors is so much more than that. Human factors is a science. It's also called ergonomics. And that science looks at our performance, how we perform, why we error, how we can improve performance. And it uses science such as psychology and engineering to help improve that performance and improve safety. So I just want to give you an example of that. A patient comes in with chest pain onto the obstetric ward, and a junior doctor sees the patient and thinks, what do I need to do now? So they clerk them and they do bloods and they do an ECG as per policy. But unfortunately, when they go to do an ECG, the ECG machine isn't there on the ward because it's been borrowed by the paediatric ward. So the junior doctor thinks, well, I could go and get one from the emergency department, but I know that the ECG machine is different and set up in a different way. I'm not quite sure how to use it. So I could also wait for the ECG machine to come up from the paediatric ward. So that's what I'll do. A couple of hours later, the registrar sees the patient and realises they haven't had an ECG yet. And the ECG machine is on the ward by now. And he goes to talk to a junior doctor and say, why did you make this error? Why didn't you do it? And the junior doctor explains that exactly what happened, and that then they were called to see somebody else. So why did this error occur? The easy way to manage this is to blame that individual and say, you should have done this differently, you should have followed procedure. But actually, when we think about cause, had an ECG machine been in both departments, this wouldn't have happened. Had the ECG machine in ED been the same as the one on the obstetric ward, again, this wouldn't have happened. So by training that individual that from now on you must follow policy and you must go and get a machine from elsewhere and do this, is that going to stop somebody in the future making exactly the same mistake? It's unlikely. What's more likely is that if we change the design of our system, if we were to decide actually we're going to get an ECG machine on each ward, or we're actually all going to have the same design across the trust, which would be really helpful in case one breaks, then it's much less likely for this to happen. I want you to take away from today's talk 3 key principles. The first one is that all humans err. Despite being amazing individuals with lots of intelligence and the ability to multitask, we still will err, and it's part of who we are. So how do we prevent that error? Well, there's 2 main things I want to be thinking about. The first is to redesign the system so that it reduces the likelihood of people making errors. And to do that, we need to make it very person-centred, very staff-centred. We need to make it so that it's hard to error and easy not to do so. That can be costly initially, but it can save a lot of costs in the long run. No matter how much we do to try and change our system and improve this, we will always find ways, however, to error. Things will change, equipment will break, staff will be absent on a particular day. And so for that reason, it's really important that we train staff within this organisation to understand about human factors and the factors which increase the risk of error, so they themselves can prevent their own difficulties and their own errors. So let's think about the 3 main components of human factors. They are individual, team, and system. When we think of individuals, we think about limitations. We can do amazing things, but we do all have limitations. And when we reach those limits, we're much more likely to error. And quite often within work schedules, we can exceed those limits regularly. So we need to be working in an organisation where we can put our hands up and say we're struggling and ask for help. And what about the team? What makes a brilliant, efficient team? Well, a team needs to have a common goal. It needs to communicate well with members within it. And a team needs to also have good leadership. And what does good leadership look like? A good leader is somebody that cares and values about the team members. So a good leader can pick out when one of the team members is struggling and can make sure that they get the help that they need. But a good team leader can also put their own hand up and say, I'm struggling, please can you help? A good team leader thinks about good communication skills and how we can improve those, such as huddles and debriefs, and making sure those happen on a regular basis. Communication is not just about being heard, it's about both being understood and the task being undertaken. And that's called closing the loop. So what about the system? We work in a system which is constantly adapting and adapting to changes from government, from commissioners, all around us, from patient changing needs. And those adaptations then pass on to individuals that also need to adapt as well. And that ability to adapt is called resilience. As a hospital trust, we need to be providing more resilience training, and this is something we're really keen to do. So culture affects all of us and the way we work. If we work in an open, just culture, we're much more likely to admit to mistakes, particularly when they're investigated in a way that isn't about blaming the individual, but is looking at why that mistake occurred. We have policies and procedures, but often we will sway from those policies and those rules for lots of reasons, but particularly when it's busy, when there's lots of time pressure, but also when systems aren't designed to make it easy not to do so. So we're talking about being open and being in a just culture. So mistakes will still continue to happen, and it's important when they do that we understand this can have a significant impact on staff, and we need to be supporting them, because it can be significantly distressing to an individual to know that they've gone to work to do a good job and yet they've caused harm by error. What are the next steps then for human factors in this trust and for us all? Well, I think the next step for you is to understand how important human factors are within your role. If you do have an interest in this or want to find out more, please pick up the phone. Talk to the patient safety team, to the Improvement Academy, talk to the education team. As a trust, we're really keen to develop a patient safety syllabus that incorporates a lot of human factor teaching into that, and those education sessions will be for everybody. But the big message I want you to take home is please speak up. If you see anything where you think patient safety is at risk, or design could be better, or staff safety is at risk, please let us know so we can try and improve the service design and think about how we can make things better. Please record any errors, any near misses, but also any things that are going really well. Because an area where things are going well, they will have probably had challenges that they've overcome, and it's important that we all learn from those. So if you do have any concerns, speak to one of your senior leadership team, or you can speak to the Freedom to Speak Up Guardian, Abby, who is always happy to hear from you, and her details can be found on the intranet. So human factors is for people that care about safety, that care about patients, but mostly are proud to care. Thank you.